Welcome to the Hustle Skirt Podcast, the show that brings you economic equity for everyone, every day, with your host, Debra Gould. Yes, I am Debra Washington Gould, President and CEO of Debra Gould and Associate Inc., a management consulting and performance management business based in New Orleans, Louisiana since 1996. My professional offerings in training, facilitating, executive coaching, management consulting, assessments, and surveys. So please visit my website at www.gouldassociates.com to learn more about my professional service offering. Today, it's all about the Hustle Skirt podcast and my guest, Dr. Cassandra Youmans. It is such a pleasure to have her here today. But before I introduce my guest to my audience, I would like to just give an overview of the mission of why I created the Hustle Skirt podcast. The mission of the Hustle Skirt is to promote, communicate, and amplify the influence of men and women in who are entrepreneurs for profit business. Yes, you heard me correctly. For profit business. And I also like to have C-suite or higher executive with from a corporate or nonprofit business. So that's the mission. But my big why about the Hustle Skirt podcast is I must be the change I want to see in others. So I come from this mindset of abundance mentality, never around scarcity. So if I can use this platform to showcase men and women from small minority woman-owned businesses to showcase and spotlight what they're doing in their products and services, then the Hustle Skirt is doing precisely what it was designed to do. So with that being said, let me introduce to my audience today, Dr. Cassandra Youmans, who is a dear friend. You're going to be excited to hear about what she's all about. But let me do it this way. Let me say hello to Cassandra, and then I want to read her credentials to my audience. Hello, how are you today?
I'm doing fine, and thank you for having me.
You're most welcome. So let's do this, Cassandra. I would like to put my glasses on so I can do the justice to, and what a privilege for me to have you as my guest today. So to my Hustle Skirt audience, here we go. Dr. Cassandra D. Youmans, MD, MPH, MS-HCM, FACP, FAAP. Dr. Youmans, you're going to have to, in your spotlight moment, tell us what some of these credentials behind your name is all about. But I would like to continue with Dr. Youmans obtained a doctorate of medicine from the USC School of Medicine in Columbus, South Carolina in 1987. She earned a Master's of Science in Healthcare Management from the University of New Orleans in 2004 and a Master's of Public Health from LSUHSC School of Public Health in 2005. She is a fellow of both the American College of Medicine and American Academy of Pediatricians. She has practiced in internal medicine and pediatrics in urban and rural communities, private, governmental, academia, and public health environments for over 30 years. Her administrative career includes serving as the Louisiana Department of Health and Hospitals, Division of Public Health, Region 1 Medical Director, from 2004 to 2006, where she served as an incident commander to one of the largest special needs shelters during Hurricane Katrina. I'm going to stop there so that during her spotlight moment, she can also tell you currently she provides direct care for telemedicine, which I am eager to hear more about her direct care via telemedicine to um, help me say this, um, hyper hepatitis B and C patients in
Yeah.
hard to reach area within our state. And pardon me, you straighten me out when we get to that spotlight moment. I don't know why I was struggling with the word hepatitis B and C. I'm happy to say of all the amazing things, she has been a proud member of Alpha Kappa Alpha sorority since 1997, where she serves as anti and basileus of the chapter Theta Gamma chapter of Alpha Kappa Alpha at the University of South Carolina. So, with that being said, Cassandra, you know I'm excited about this moment with you. I have been texting, calling you. You have to do this. I want to have phenomenal women like you spotlighted so that others can see the brilliance of what you bring to the community. And especially the work that you're doing in terms of telemedicine. So with that being said, hello, how you doing today, Cassandra?
I'm doing fine. It's a beautiful day in New Orleans.
Yes, it is. We've been blessed with a lot of great weather, probably in the last 20 days plus. My guests know that I generally have a couple of questions, a general, a specific, as well as a fun question. So we're going to get right into these questions so that we can give you that spotlight moment to add more to the brilliant work that you have had such a prestigious career leading up to what you do in your practice today. Here's my first question. Looking back over your life, what are you most proud of? Would you share that with my audience today?
I think that's an easy question to answer. My two children. My daughter is the oldest. She's 26. My son Philip Michael is 2 years younger. They're hardworking. They're kind. They're caring. They're just good character people. Um, they're good humans. And if they weren't my children, I would want to know them. Um, I thank God for that. I don't take all the credit for how they turned out. But since I was the vessel that they journeyed through to get here, I'll say that is what I'm most proud of. Both of them were born and raised in New Orleans. They attended Hines Charter in the French immersion gifted program. They were also at Ben Franklin for academics in high school. They had frequent visits to South Carolina, and because that's where I was born and raised, and we have family there. So they were even baptized in my home church of Huspa Baptist Church in Hampton, South Carolina. Sydney loves to travel. She's a foodie. When she was a little girl, she would sit in front of the Food Network channel. Feet could not reach the floor. She'd read cookbooks, and her one part of her love language is to cook for her friends. She loves to entertain, and that's usually around her cooking meals for her friends. She was the editor of Spoon Magazine at University of Southern California, and she graduated from USC in accounting, and currently she's an auditor for Ernst & Young out of the San Francisco office.
Well, I can certainly tell you're proud of your young people.
Now,
That's a wonderful share.
Philip Michaels, he's bright. He's artistic, and he's a filmmaker. So Philip attended Ben Franklin for academics, Hines, as Sydney did. But the second half of the day, during his sophomore, junior, and senior year, he went to NOCA, which is the New Orleans Center for Creative Arts. And so he got his training in media arts there. He completed his first feature film the summer before he entered into his freshman year at NYU Tisch School of the Arts, and he hit the lottery. He ended up winning the Tribeca Film Festival for his debut film. So when that happened, you know, opportunities in Hollywood opened up for him, and so he took advantage of that. The film is called Burning Cane, and Ava DuVernay's company, Array, is distributed the film. It was on Netflix for maybe like 3 or 4 years. It can still be viewed. And so, yeah, they are definitely what I am most proud of. But, you know, that's a God thing. I give him all the credit for how they turned out.
Well, right on to you, proud mother. I did not know. I'm just assuming because you were from South Carolina, that's where they was raised, but I didn't know that they was born here in New Orleans, attended a public school, Benjamin Franklin, and the fact that they're so successful in their career give you all the reason to be so proud of Sydney, as well as a leading firm in accounting and your son in filmmaking. That's powerful. Well, you have every reason to be proud. So we're going to continue with my next question. This one's a little more specific.
Okay.
Why did you choose a career in medicine?
You know, I've been asked that often. I grew up in the 60s and 70s. Civil rights and social justice was an issue in our community then as it is now. The only opportunities for advancement and survival that I saw was through education. My parents were both teachers, and they were the first in their generation to, at their time, to be able to graduate from high school and also to go to college. Prior to my parents' time, colored school in Hampton, South Carolina. My parents are Philip and Myrna Youmans. Prior to that time, the colored school went to the 8th grade. So for Black families, if you wanted your children to go to high school in Hampton, you had to send them away. Well, many families did not have the resources to do that. My great aunt Aura is 105 or 106, and said that she loved going to school, but she would have to work 5 miles to go to school and then 5 miles to come back home. There were so many barriers for her at that time that she did not get to finish school. So I also want to say as an aside that my Aunt Aura votes in every election, and I am certain that she has already early voted for this election right now. So education was valued and instilled in me. So I do remember 2 TV shows when I was a child. It was one that I loved was Marcus Welby, MD. He was played by an actor, Robert Young. He was a family physician that reminded me of my family physician, Dr. Tootin, that was in Fairfax, South Carolina. And I also watched this show called Medical Center. The actor was Chad Everett. And I looked at that and I said, you know, I could do that. You know, I think that would be something that would be interesting to do. Now, all the physicians that I knew were white men. I had no one that looked like me that was a doctor. I didn't even know of any doctors that were Black. But inside my home, all things were possible if you were willing to work. So in spite of the barriers that we were experienced in the community, for some reason, I never saw that as a barrier to me. And I give my parents all the credit for that, because I just grew up with the expectation that if I worked hard, I would succeed. And school was something that I excelled at. So that's what I did. I think the last thing that really impacted me was my grandma Emma, my mom's mom, had 3 strokes before she died. And she was aphasic in the last 6 months. And I was very frustrated because I didn't know if everything that could be done for her medically was being done. And I felt, just a little frustrated. I felt helpless, and I didn't like that feeling. So I'm sure that my experience in helping my mom to take care of my grandmother, and that was over a 5-year period, that really did strongly impact me wanting to become a physician. So when people would ask me what I wanted to do, and it would be, I think it was around middle school, I started getting those questions, and I would say, I want to be a doctor. They would say, oh, no, you mean a nurse? And I said, no, I mean a doctor. So there wasn't a lot of encouragement in the community. I think people thought from where I was in that small town of Hampton, South Carolina, that I was really kind of shooting too high. But I was steadfast and I said, I'm going to try. If I fail, then I guess that's not what I was intended to do, but I'm going to try first. And
Well, I love
yeah.
the question. I love your big why. More importantly, I think my audience heard steadfast, but I'm going to add immovable. I love how that 8th grader said, no, I'm real clear. Not a nurse, but a doctor. Thank you. I was a big fan of the Marcus Welby, a Robert Young program too. So
Yeah.
I have one more question because I can't wait to get to this mindful moment piece where you get the spotlight because I want to learn more about the telemedicine piece. Let me squeeze in one more question, Dr. Youmans. What one word would you use to describe yourself? I can
Well,
think of 10, but I want you to give me your good
well,
word.
you're very kind. I always learn from you. I will use the word that other people have used uh, repeatedly to over the years to describe me, and that would be bridge. The first time I recall hearing someone refer to me as a bridge was like in the mid 2000s. I was leaving my position as Region 1 Medical Director for an advanced opportunity with the Department of Public Health out of Atlanta. I was stationed at East Central Health District in Augusta, Georgia. So it was a promotion for me in sorts. And so I ran into the CEO of X Health, who's Mike Andrew. X Health is a federally qualified health center. They take care of underserved. And he said to me, I hate to see you go. He said, who will be the bridge now? And so I was on a call the other night on one of our sorority committees, and one of our sorority sisters referred to me during the call as a bridge. And
Wow.
yeah, so relationships.
That's your word. That's your word then. But if I had to name my list, I would say assertive, active listener, people builder, and a great communicator. You are a servant leader. I would say that you are disciplined and you're consistent. And I would just say, in your own way, that you are bold and firm. And what I like most is that you're direct. So, and straightforward. So, those are some of the things when I'm in the same space with you, what comes up for me as I listen to you, as I listen to you serve and share, and to be you have a way of being a challenger, but you're also a contributor. So my strong word would be contributor. Of all the things I said, which had taken me over 10 things, it would be that one word. I would say contributor. And that's what you do.
Well, thank you
So
very much.
I'm going to stop talking because I want my audience to hear how much I love on you and the things that you do as that contributor, as that challenger, as that communicator. So I'm going to say, take it away. And in your mindful moment, this is your chance to spotlight. I would like you to share how can someone contact you if they was interested in your services. But there was a few things I might have left out as I was reading your bio. If there's anything else you would like to add in these next 3 minutes, please do so, Dr. Cassandra Youmans.
Well, I'll say two things about kind of bridge building and relationships are really important to me with my family, peers, the community. I'm very outcome oriented. I'm not really interested in gossip and mischief because I think it's just that mindset distracts you from being productive. So it's also important to know that whatever you achieve in life, that you don't achieve it in isolation, that there are people that have assisted you along your journey. So that's always the case. Certain individuals can get the credit for the success of this or that, but alongside those people, behind those people, surrounding those people, there were people that supported and lifted them up, and that was a collective um, effort that brought about that outcome. So, you know, before Katrina, we had huge challenges in providing healthcare services to underserved patients. So you had to create relationships with people and motivate them to want to share resources and share information. Post Katrina, there was a healthcare crisis. And we had no budgets prior to Katrina. Post Katrina, no one had healthcare access because there was massive devastation. So everything had to be rebuilt. So now we had the political will and the environment for people to now come together. We didn't have to spend time convincing them to share resources or look to ways that we can complement and not duplicate because resources were so scarce. Everybody was willing to sit at the table now because if they didn't, they wouldn't survive. So that was a part of what we were doing post Katrina and opening up a lot of, we had healthcare clinics in trailers and we had open school-based health centers. We were in New Orleans East. We merged behavioral health into our primary care centers. We were really trying to address the majority of the needs that our patients have. And mental health post-Katrina was a big one. I did a survey, and to be honest with you, about 66% of the people in there had some form of depression or anxiety. And a lot of it was PTSD related, because of the storm. But so a bridge, I like to, know that even if it's a small part that I contributed in doing something that was good for somebody else, and that's very satisfying to me. I think that's part of my purpose. Now, in terms of the hepatitis clinic, hepatitis is a big deal because people are asymptomatic. They look as beautiful and healthy as you. And unless someone screens them, they can live with it for years and years and years and no one know they have it. Some people wait and you go to a doctor, they see your liver enzymes elevated, they'll say, I'll check them for hep C. But there's a third of people that can have hepatitis C and their liver enzymes are not elevated. You can get it having sex with someone who has it. They don't blow. They look healthy. You can get it from coming in contact with infected or contaminated blood. I've had a lot of patients that had blood transfusions in the 80s that got it. I've got people who had tattoos placed with friends and got it. The reason that is so important is because if you develop hepatitis C over the course of years, you can develop cirrhosis of the liver or liver cancer. And unfortunately, I've taken care of far too many people with liver cancer as a result of having hepatitis C. So this is something that's preventable if you are screened for it. I do believe that every adult should be universally screened for hepatitis C. I know pregnant women are being screened for that along with HIV and other things. So they're trying to get it on that end. But it's also important to get it on the other end. And if your doctor does not offer it, then I think that you should ask your doctor for it. Now, I've been doing this virtual telemedicine clinic since 2013. And when I retired from the LSU in April of this year. They did not have anyone to continue that version. My land-based hepatitis clinic and primary care clinic is being continued by my peers that are still with LSU and University Medical Center. But the virtual clinic, I was fortunate enough to be able to continue. I love the clinic. I've had an association with Kemp Medical Center, which is an LSU hospital. Is the only state hospital that's still operated by Healthcare Services Division, and they provide this service. So you don't have to have insurance. You can have Medicaid, you can have commercial insurance. If you have hepatitis, you can access care through us, and we do provide the services virtually, so you don't have to physically be in front of me. As a matter of fact, I'm at a remote location. Okay, so some of my patients I'm taking care of on the phone. Some of them come to the hospital. I have a nurse navigator there, and they're seen there. They get
Is
their.
there any contact information that you can share with my audience if someone needed to seek the service at LSU, or to reach you directly, or to know how to receive this service about the hepatitis B and C?
Kemp Medical Center is LALLIE Medical Center. It's in Independence, Louisiana, but the number to Kemp Medical Center is 985-878-9421.
Can you repeat that one more time, please?
It's 985-878-9421. That is Kemp Medical Center. My nurse navigator's name is Jakayla Costin, Jakalae, Costin, Coston. And you can access our services through her. Another number, I think, to her assistant would be 985-878-1605. Again, 985-878-1605. If you are uninsured, then we will put you to the process to see if you qualify for free care at Kemp, and that's based on income. But that does not provide for your medication. That just provides for seeing the doctor and getting your lab test. To get the medications, we would facilitate your applying for Medicaid. If you're disqualified, then we would go through support path with Gilead Pharmaceuticals, and we would obtain your medications through their indigent care program. So if you have hepatitis, you come. There's never been a patient that we've turned away that we've not been able to successfully treat.
That is wonderful. What a tremendous blessing you are to a community. I'm so glad we had this opportunity today, Dr. Cassandra Youmans, to be here today on the Hustle Skirt podcast. I appreciate you sharing the contact information so folks will know while they listen to this interview, it's going to be available at future dates, and they can hear it several times and share it with others in their community. So at this time, we're going to close out the show, but it's always an opportunity to hang out with you. I've had a wonderful time, more in education and awareness, because we spend a lot of time together, but to hear about your career and the difference that you're making in our community, and how in your profession during post Hurricane Katrina, the significant work that you was doing in my particular area of the New Orleans East. With that being said, I'm going to say thank you for the value of your time today. And as I close out, I want my audience to know what you're doing today in your medical practice from South Carolina, that motivation as that eighth grader that was clear. No, I'm talking about being a doctor. Mm-hmm. Watching those TV programs, that was a bigger motivation. Having a loved one who've lived a long time, who had a need that motivated you even more to step into this profession. And look how you have blessed so many people that's been in the same space with you, Cassandra. So as I close out today on the Hustle Skirt, the objective is to empower you to speak up, to speak out, to embrace change. That's what we heard today from you, Cassandra, in your own vision and your mission. Thank you for being my guest today on the podcast. I want others to know how to watch this interview. If you kindly go to the website www.persistencelane.com, all one word, where you can subscribe to the Hustle Skirt. There will be 9 different platforms from Apple's, Google Podcasts, iHeartRadio, Player FM, Amazon Music, Podchaser, iTunes, and Podbean. And while we're at it, if you found value in this particular interview with Dr. Cassandra Youmans, I want you to give us a rating on iTunes, or just tell a friend about the interview, or someone in your family, friends, or your community that you was watching the Hustle Skirt podcast with Dr. Cassandra Youmans. I'm going to take us out today with this message. You are listening to the Hustle Skirt podcast, the show that brings you economic equity for everyone, every day, with your host and founder, Debra Gould. Cassandra, until we meet again, I'll see you in a few days, by the way, and make the best of the rest of this particular day. And you know I'm blessed that you did this for me today. Until we see each other.
Thank you, Sarah.
Oh, you're welcome. Till I see you in a couple of days. This was a great interview. Thank you, madam. And say hi to those young adult children that's doing some amazing work in their careers.
I will.
Bye-bye.
Bye-bye.